Hello everyone, welcome to my channel. Hope you are doing well. So in this video today we will discuss myocarditis. In the previous videos we have discussed pericarditis and its management and some of the practice questions related with the pericarditis. So today we will study what is myocarditis and one practice question also. So let us start. What do you mean by myocarditis? It's very simple. It is an inflammation of the myocardium. So how it will develop or what are the causative factors of myocarditis? Usually it can be lead to any of the viral, fungal or bacterial infection, or sometimes it may be because of the pericarditis. If the client those who have diagnosed with the pericarditis, there is a chance of developing myocarditis. Then what are the common assessment or the clinical features? The client might have a fever, pericardial friction rub and murmur. So these are some of the main features. Then how to treat or how to manage myocarditis? Starts with some of the analgesics, then NSAIDs, then digoxin, then antibiotics. So this is a very small topic, but you should have an idea. Now we will move to a question. The nurse prepares to administer clozapine to a client with schizophrenia. Which client statement would require priority investigation before administering the medication? A client, she is a case of schizophrenia and now she is on clozapine therapy, or she is receiving clozapine medication for the treatment of schizophrenia. So while she is on this medication, which statement or which finding she will inform to the nurse that require more assessment or more investigation or priority investigation of the condition or of the present situation? Which means now might be the client, she will inform, I have this problem, I have that problem, and out of those problems the client mentioned, which one require an immediate assessment or intervention, or which one shows it is a serious problem or it might be a complication of clozapine therapy. So that the question asks. Always try to understand or try to read the question or reword the question, because sometimes the students, they will read question, they will come to the options, then again they will go back to question, they will read, you might get confused. So first of all, try to understand the question clearly, then come to the option. So that will help you to pick the correct answer easily. Otherwise, definitely there is a chance of getting confusion is more, because in this kind of exams, the questions they will never ask as a direct one. Might be they are asking clinical features, but they will ask in a very big scenario and is indirectly. So please try to understand the question first itself. Now we will see the options. Option 1 says, I have gained a few pounds since I started this medication. Option 2 says, I have had sore throat for 3 days and feel feverish today. Option 3, I have noticed increased salivation and drooling. Option 4, I don't feel sleepy when I take this medication. I often feel sleepy when I take this medication. So what do you think? Which could be a very serious or dangerous issue or finding out of these 4 points mentioned by the client? Before going to that, you should have an idea about clozapine. Then only you can answer this question, because this question is specifically related to clozapine. In the previous video, while we are studying mental health nursing, I have already discussed some of the points related to clozapine. I hope you might have watched that video and now you have some idea. Anyway, now just we will refresh that ideas. What is clozapine? It is an atypical antipsychotic medication which will use for treating schizophrenia when the schizophrenia is not responding to any normal or traditional antipsychotic medications. Keep that in your mind. Usually this clozapine we will not start for all client who is diagnosed with schizophrenia when their disease or when their schizophrenic problems are not resolving or not responding to the normal antipsychotic medications or normal traditional treatment. That is the time we will use clozapine. because it's a good medication. But why we are not using in the initial time? Because it have very serious complications. The side effects are very severe, lethal side effects. So that's why we will not use as a primary medication for schizophrenia. Okay, now anyway the client is already on clozapine therapy and the treatment already initiated. So while going to administer the next dose, the client mentioned, I have this and this problems, so after I start this medication, so what I will do? Out of these points, which one will make the nurse to suspect, okay, this is something very serious and that is totally related to this clozapine. So what she should do? She should halt, she should inform to the doctor, she should do the immediate assessment and further interventions. One of the main problem of clozapine therapy is that it may increase weight. Weight gain is one of the side effects of clozapine therapy. So that is the option says here, I have gained a few pounds since I started this medication. So that is one of the expected side effect of clozapine therapy. But that is not that much severe. So we will just keep that one now. Then another one side effect of clozapine is that it will increase the production of saliva. So when the saliva will produce more, what will happen? There's a chance of drooling, especially during the time of sleep. And if there is more saliva, there may chance of aspiration also. It poses the risk of aspiration. So what we will tell to the client after starting the therapy? So try to have some try to choose some sugarless gum that will promote the swallowing as well as decrease the drooling and aspiration. So that is also, this option 3 also an expected side effect, and upon initiation of this therapy, usually the nurse or the doctor will instruct the client, you might have experienced this side effect, so you should use this sugarless gum, or you should take care, don't create any situation for aspiration, avoid the chance of aspiration, everything will instruct. So that is an expected thing. That is not much serious, but we will keep it because here they ask some of the priority problem. So option 1 and option 3 just we will keep it because these are some of the expected findings and already given instruction by the nurse to the client upon initiation of the clozapine therapy. Then what is the option 4? That is, here they said, I often feel sleepy when I take this medication. So this is also eventually an expected finding or side effect of clozapine, but that is not much severe. So when they have more problem with this drooling or salivation, or they have more problem with the sleep, they might be just renew the order of prescription of the medication. If there is more salivation, they might be lowering the dose of clozapine, and again observe how the client is responding or whether the symptoms are resolving. So these all things can be do. Here option 2 said, I have had a sore throat for 3 days and I feel feverish today. What does it mean? We know that one of the serious life-threatening lethal complication of clozapine is that agranulocytosis. What does it mean? Which means when the absolute neutrophil count and the WBC will be dangerously low. When this WBC and absolute neutrophil count will be low, what will happen? Definitely the client will develop infection. Yes, here the client is showing a sign of infection. I have had sore throat for 3 days and today I have fever. So when the nurse will listen this finding from the client, she will suspect, okay, this is a chance of developing, or the client is going to agranulocytosis, and I should not continue the medication. I should check further as well as I should inform to the healthcare provider. Otherwise, it may lead to some of the lethal or fatal complications of the client. What is the normal absolute neutrophil count? It should be more than 2000 mmHg, and the normal WBC should be 4000 to 11,000. So when the absolute neutrophil count and the WBC will be dangerously low, and when the client will show these signs and symptoms of infection, we should suspect this complication of agranulocytosis. And also the client, those who are on clozapine therapy, should have to go for a periodic examination of WBC and absolute neutrophil count, so we can know how, whether it is maintaining, whether it is going low, whether how the status of the client. And some of the other complications of clozapine is like a seizure, because infection will cause seizure, and some client they have, some client they have a cardiac diseases like myocarditis. So myocarditis also a problem of this clozapine therapy. That's why I try to put this question here. When you are reading this question, you will think all the things about mental health nursing only. You will connect everything about the antipsychotic medication of clozapine. But some of the side effects are connected with the myocarditis. So whenever you will see a question, please try to connect the dots. Please try to connect the points that you have. Please, when you are listening something, try to suspect what does it mean, or when this we will see this finding. Okay, what might be the indication? So this is the best way to study a question, study the topic. I hope myocarditis is clear to you, and now you might got the idea how the questions are connecting. So if you like the way we are discussing and our videos and our classes, please subscribe our channel and press the bell button. We'll see with a new topic on the coming video. Study well and all the best for your exams. Bye bye.